I really appreciate the fact that Thousand Lives have taken on falls prevention as one of their campaigns. I feel that falls affect so many people, or the fear of falling.
It frightened me. I thought if I go on falling at this rate, I'm going to break something badly. It really made me feel awful because I fell in the bathroom, and so that I caught the back of my head and my neck and shoulders on the side of the bath.
I've had a few falls, and luckily enough, my grandson was there, and he's a big lad, and he picked me up. My wife, she's partly disabled, so I think she's waiting for a new hip and all this and the other.
We have people who come in to attend the falls programs. We then go through a falls assessment, a risk assessment with them. So when the person comes into me, we sit down in a very safe, private place and talk about all the elements that affect their life, really. Each week we're assessing them continuously, making sure they're safe and promoting the falls prevention elements. And then we also have the physiotherapy and the occupational therapy input as well.
I've always been a very active person. I'm independent. I like to do things for myself, but I find I can't now. And it gets very, very frustrating, to be honest with you.
And I had 8 sessions, 7 sessions, and then an assessment of the physiotherapy treatment. And I had a little card written out what I had to do at home.
If I get up now, they have taught me here how to pick myself up there like that.
And every time you came to this unit or to the physiotherapy down there, they made you feel special.
Thousand Lives brings through the quality, the excellence that we need to achieve. Then it also gives us that ability to manage, to make our changes, and it helps us do it in small ways, so it gives us that step-to-step approach.
I can't tell you what a difference it's made to have their help, because I've got no family living near. And if you live on your own, well, you need to feel that you can just pick up the phone to get in touch with someone. All I have to do, if something happens, if I fall, I hope I won't fall again, not after the wonderful treatment I've had.
I've learned how to use the PDSA cycles to make small changes, which make actually quite big differences to people.
You can take your time with your answers. And if you were old, you've got to take your time.
We've used driver diagrams to highlight to us what we need to do. I think the bundles have helped us to focus on certain elements of the falls prevention programme, and then using the database as well to in a way record and use it as an audit tool, really, to work out where we need to improve.
But this unit here has stopped me feeling awful, because I consider them now, all of them, as my friends.